Hey, 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 hey.
What's up?
Hello, how are you?
Good. How you doing? Whoa,
I'm very, very well. And yourself?
doing great. You see that? Like at the top, is it scrolling real fast? What is a foot exam?
What do you see?
Like the title is like, "What is a foot exam?" It's like scrolling real fast. That's
I'm
just on my end.
scrolling across.
Oh,
Yes.
I don't know. Just looks different.
I don't think I've noticed it before.
Yeah, I don't think it done that. Anyway, I don't
Yeah.
know. Just caught my
Yes. But that jumps right into our topic
eye.
today. We will be talking about what is a foot exam. And what's funny today, I did ask a gentleman today what a foot exam was, because as I was going over my notes between clients, he was just telling me all these different things that he was feeling in his feet and all the things. So I had asked him, hey, when's the last time you had a foot exam? And he actually said it's been a while. I thought he was going to say never,
Never.
because
Yeah.
I don't think I have. I know I haven't had a foot exam before.
Mhm.
And I just assume that most people have not had a foot exam. So, getting right into it, let's be real. Most people don't think about their feet until it hurts or until something hurts. But today we're talking about something that can literally save your limbs and your lives. So, Dr. Lanier, when people hear foot exam, they think pedicure or pain. So let's start with simple terminology and what is a real foot exam?
Yeah, so basically, in the simplest terms, a foot exam is getting your feet examined by a licensed professional. That's what a foot exam is. So it really can be anybody. It can be a podiatrist, it can be your primary care doctor, it could be a chiropractor, it could be a nurse practitioner. Each of those types of professions are going to examine it differently. And obviously, I'm going to be a little bit biased and say that a podiatrist is probably going to give you the best foot exam because that's what they actually specialize in. So that's the basics of a foot exam: getting your feet looked at by somebody who knows what they're doing.
Absolutely. So, who should be getting regular foot exams? I was thinking this was just something that a lot of athletes would get more of,
Mm-hmm.
but I'm sure you're going to tell us different.
Yeah, and so I think anybody really over the age of like 40 should probably be getting a foot exam. But if we want to narrow it down a little bit, certainly people who are, on their feet a lot or who need for a high level functioning. So just like you were saying, like an athlete, they want to make sure their lower extremities are functioning at the highest level. So, but the thing about it, a foot exam for, let's say, an athlete who, has to, perform at the highest level in their sport is going to be a little different for, kind of your average person who is pretty healthy, which is going to be different for, let's say, someone who has diabetes. So there's going to be kind of, small subtleties to that foot exam that's going to key in on various things depending on who you are examining.
Okay, so my first question is, you said those that are 40 and up should
Mm-hmm.
be regular. What is regular? Like annually, quarterly? What does regular mean?
Yeah, good question. So generally it's annually. So, I would say someone who's low risk, and let's say they're 45, when they go to their regular doctor for their, annual physical, it should include taking off their shoes and socks and making sure everything looks okay. Making sure their nails look pretty good. They don't have any signs of fungal infection. Looking in between the toes, making sure they don't have, skin peeling. Looking at their heels, making sure they don't have fissures and cracks. And someone in that age group is a very, pretty much cursory exam. You're not thinking that they're going to have a lot wrong with your feet, but you still want to look at them. You want to check their blood flow, various things of that nature.
So you said that your exam would be a little bit more detailed, but how long would your exam? It says like your exam versus you said these other practitioners. What is the length of the time frame for each of those exams?
Yeah. So for my exam, again, depending on who it is, pretty much my whole, visit with me is going to be obviously the foot exam, depending on what they're coming to me for. So if it's someone with diabetes, is a lot more extensive than it is for, someone who is just coming, and really doesn't have any problems that they're talking about. If that same person is probably going to their primary care, obviously the primary care has a lot more to go through. They have the cholesterol and the mammograms and all this kind of stuff. So a foot exam is probably going to be pretty quick when you go to your primary care. They're just going to make sure everything looks okay. And if it doesn't, they're probably going to refer them out to more than likely a podiatrist if they do see something that needs more attention. If they're going to maybe a chiropractor, maybe the chiropractor is more focused on their low back pain or their neck pain. And if they're having low back pain, they may say, oh, let me take a look at your feet just to make sure, you don't have fallen arches or you're not pronating. So that's probably going to be like their foot exam. So, a lot of times different practitioners, they're going to get a foot exam because maybe it ties in to something else that they may be treating. When you're going to the podiatrist, obviously their main focus is going to be your feet, your legs. So, just by the nature of what we do is going to be more in depth.
Do you blame the doctor physician community for not putting it on our radar? Like, October is breast exam, or we know we should get our eyes checked every year. We know we should get our teeth cleaned, or could go to the dentist. Who do you blame for not making this like a regular checkup, like those other exams are promoted? Versus most people don't tell us about getting foot exams.
Yeah, so if you got to put blame on somebody, you got to put blame on the foot people, right? Like the foot doctors, right? Like our societies and the folks who should be putting this at the forefront. We do have a lot of people in our profession who advocate for this, but it really takes our professional groups to say, hey, we have to do a marketing campaign nationally to let people know that their feet are important. The dentist did that. They said, hey, you had to get your teeth checked twice a year, to make sure, your teeth aren't rotten or you have gum disease or whatever the case may be. I don't think that we have, banded together and said, let's get a national campaign going so that people know, how important a foot exam is. People know how important their feet are, especially like you were saying, if they hurt. The old adage is what if your feet hurt, your whole body hurts. And, when people start to have that foot pain, then it does come front of mind. But how do we get people to say, well, my feet aren't hurting, but I know they're important. Let me go and get them checked out once a year just to make sure they're okay. So if I had to lay the blame on someone, it has to be us. It has to be the people who are in charge or who do this every day. It's the foot doctors. Absolutely. And anyone who's involved in lower extremity health.
Yeah, so I feel like responsible for that blame too, because
yes.
I'm dealing with the lower extremities. So I think I will begin to start at least introducing the conversation. But like you say, it does have to be a national campaign over years and years for it to be considered normalized as breast and teeth and all of those other things. So here is a data drop. Let's put some numbers behind this. So nearly 85% of diabetic related amputations are preventable with early care. And I feel like that early care would probably be like regular foot exams.
Yes.
1 in 2 people with diabetes will develop nerve damage in their feet. Most people lose sensations years before they feel pain. I would like you to explain more about that. Of course, we talked about this last week, but we're still in Black History Month. Black Americans are twice as likely to experience lower limb amputation, and poor circulation often shows up in the feet before heart symptoms. So my first question would be like, would there be an opportunity for the foot community to partner with the Heart Society and say, hey, we can bring some synergy to this, we can possibly check for, it would lean into heart disease if we would start checking in with our feet first?
For sure. So a lot of places do this. So even, some of the, the hospital colleagues that I have, we work very closely like with cardiology and with vascular doctors. So when someone comes into me and, I'm doing an exam and let's just say I don't feel really good pulses, the first thing that I do is I get them into, our cardiology and vascular colleagues there. So the same thing, like if someone, but it should be the reverse too. So let's say someone has a heart attack or a
Yes.
stroke, then the next thing that that cardiologist or neurologist should say is, well, if the blood vessels in your brain or in your heart are probably clogged and not doing well, probably those blood vessels in your feet aren't doing well either. So you should be keyed into a podiatrist. And so even if that patient is not having any type of foot, ankle, leg problems, but they had a heart attack, that should be an automatic referral to a podiatrist. Now, we're not there yet for sure. But like you
Really?
were saying, we're not. No, if someone has a heart attack, I mean, obviously the first thing is to save their life. So, unblock the artery that's causing it. But as a strategy for follow-up care and making sure this person, doesn't continue to have any sequela from that heart attack, one of the, people that they should be seeing should be a foot doctor.
And I know I hear this all the time that issues show up in your feet before they show up. So if you're having heart issues, you're way past like the foot being a problem or
Oh, for
going to
sure.
check the foot. You're way past that.
But so that's why it's so important for people to get those foot exams when they don't have any type of symptoms, whether it be foot, leg, heart, brain, whatever it is. Because if you come to a podiatrist, so one of the things that we do, we test blood flow. So there's a few ways to do that. I mean, the most simplest way is we lay hands on the patient and make sure they have pulses. If we can't feel pulses or they don't have them, the next simplest way is getting, like a small ultrasound to hear the pulses. And if we don't hear any pulses, then that's a red flag for us to say, hey, we got to get them over to the vascular surgeon, the cardiologist, because if they don't have pulses in their feet, they probably should be getting checked everywhere. Their carotid arteries, the coronary arteries, everywhere, because if the arteries in their feet are blocked, then they probably have blockages everywhere else in their body. And so those patients we should be a lot of times at the gateway, to making sure that everything else in their body is doing well. Just like we talked about before, if I'm looking at a patient, they have no hair on their feet, especially if it's like a male, he has hair everywhere else, got a full beard and everything, but then you look at their feet and it's like no hair anywhere. Their skin is shiny. It looks kind of thin, it's blotchy. Those are all signs that, hey, you may not have good blood supply to your feet. And we can do a lot of testing. Most of it is not invasive, it's ultrasounds and things, nothing to be scared of. I always tell people that. I say, hey, I'm going to send you for a vascular test. It doesn't hurt. There's no needles or anything like that. And it's just a simple test to make sure you have enough blood flow to your legs. And so, if we catch it early and, we get that vascular test and it says, yeah, their blood flow may not be the best, we may just put them on medication. Or we may just tell them, hey, you need to exercise more. You need to walk more. You need to eat healthier. But if you didn't get that foot exam, and you wait 2, 3, 4 years, then we get that test when you kind of start to have leg pain. That test probably is going to show that you got a big blockage, and now you're looking at having a stent put in or something like a big bypass surgery on your lower extremities. So we're trying to not eliminate the need for those, but decrease the need for those invasive procedures that carry risk. And if we can catch someone super, super early, then we can handle the problem a lot easier.
I am so shocked to hear you say these things. Like, foot exams should be like how they push breast exams. Like, we could be saving people's lives.
For sure.
A foot exam, but it is like quiet crickets comes to people being told to talk about getting foot exams.
Yeah, we don't have the fancy walks. We don't have the months and everything like that. Not to say that all the other stuff is not important, because it is very important. But I think it's equally important to save people's limbs and to make sure that they're getting checked so that we can potentially save them from heart attacks and strokes and different things like that.
We need to look into see if there's a day for, is there a month already for foot exams that we don't know about? Or is there a dedicated day? Or maybe we should enter, because I saw there's a list you can submit what day you want. And if it's not already taken and, it goes through some stipulations, we could actually have a national foot exam day.
Let's do it.
created.
Even if we do have it already, no one knows about it.
Nobody knows
We're in
about
the
it.
foot industry and we don't know about it, so the general public's not gonna know about it.
Absolutely. So I'm going to task us with kind of doing some homework around, is there a day or a month? And if there is, we should definitely be out here championing it.
For sure.
Yes. So to expound upon one of the data drops, most people lose sensation years before they feel pain. How do you lose sensation years, but then you can start to feel pain? How does that connect?
Yeah, so basically what that's saying, so most people, and mainly you're talking about folks with diabetes,
Yeah.
right?
Okay.
So people, they start to very, very slowly lose the feeling in their feet. And we call that diabetic neuropathy.
Yes.
But when most people don't know that they're losing sensation. So when you're in the early stages of it, people come to my office, and one of the first things I ask folks who come in for a diabetic foot exam is, do you have any burning or do you have any tingling in your feet? A lot of people in the early stages say, no, my feet are doing great. And, there's a test that we do with a really, really thin kind of, it's called a monofilament, but it's like really thin, and it's almost like a flexible, like pin, like PIN pin. And we basically lightly touch different spots on the foot. There's 10 areas that we touch. And we have the patient close their eyes or look away, and we touch it, and it gives a consistent pressure to those areas that's been validated, and they let us know if they feel it or not. And even in the early stages, people will not feel it. I'll say, hey, open up your eyes, and I'll tell them you only felt 6 out of 10, places, and they'll be shocked. They'll be like, what? I didn't feel it, And so, that's letting them know that they're starting to lose that feeling in their feet, even though they don't know it. When they walk around and do various stuff, they probably still have pretty good feeling, but it's an indicator that they're starting to lose the feeling. And we know that when people start having neuropathy and they start losing feeling in their feet, it significantly increases their risk of having an amputation. And so that's one of the main risk factors for folks having amputation, is to start having symptoms of neuropathy. Now, getting back to your question, early stage is where they just start to lose the sensation. When you start to get to middle stage and late stage, middle stage, they kind of know. They're like, yeah, my feet feel tingly. They kind of feel numb. Sometimes I really can't feel, my spouse, she'll be in the bed and he or she touches me. I can't really feel it on my feet. That's kind of middle to end stage. And then kind of more end stage is then it becomes painful. And so the nerves are firing so much and they're not functioning, they become painful. And what most people will say is that it's painful at night. They do well during the day. They have no problems because their mind's not on it. They're not, they're stimulated by other stuff.
Right.
But in the evening, when they start to get ready for bed and they try to go to sleep, it's hard for them to go to sleep because their feet are always kind of on. It's kind of buzzing and burning, and it's like it's ants crawling on my feet, and it's very hard for them to fall asleep. And so that's kind of where it says, they get that numbness, and then it can become painful. But by the time it's painful and really numb, we really kind of miss the boat. We really want to catch it in that early stage. Most of the time people start to get this neuropathy because their sugars aren't under the best control. So if we can get it early, we intervene, we get their sugars better, we get them eating better, we get them on maybe some supplements and things that help nerve health to try to delay or decrease, that painful neuropathy that can come.
Interesting. Wow. Okay, flabbergasted. Okay, so what are the most common things that you catch during a routine foot exam that patients had no idea that was happening?
Yeah, so probably one, decrease in their blood flow. And so when it's really early, people don't really know that their tissues are starving for blood. Sometimes they'll come in and say, my feet are cold, or, my skin looks a little different than what it used to, but they're really not putting that together that they're starting to have blood flow issues. So probably number one is, catching people when their blood flow is starting to decrease. And again, we want to catch it early. Number two is the neuropathy. That's always, especially if it's, folks with diabetes, neuropathy is one very common thing. And kind of the general population, also what comes with the foot exams are x-rays. And so a lot of times, we pretty much x-ray everyone that's coming in for an exam because we want to make sure they have proper bone structure, their joint alignment is good, they don't have any significant arthritis or anything. But one of the most surprising things is that when people come in, they're maybe 40 somethings, 30 somethings, and we get x-rays and I tell them like, hey, you're starting to develop arthritis, in particular joints. And, if you're like 35 years old, most people aren't thinking about arthritis. Sure, a 70-year-old comes in, I tell them they got arthritis. They're like, okay, tell me something I don't know, doc.
Right.
But a 30-something-year-old, they probably don't know it. And a lot of times it'll be that big toe joint because that just takes so much pressure and so many forces go through that to propel us and push us through our gait cycle and through walking. And they'll end up having, arthritis in their big toe joint. So that'd be a surprising finding for a lot of folks, knowing that they have arthritis in their joints. A lot of surprising findings too is like people think that they may have a normal arch. And so we look at a lot of arch height and how their arches are falling. And a lot of people have fallen arches. And I would say probably, a good 75% of folks could benefit from orthotics that come and see me, even if they don't have per se foot pain. But a lot of people will have like soreness. They'll be at work and after an hour or two, they have quite a bit of soreness in their arch. And, they could benefit from an orthotic in their shoe to help support their arch so that their muscles aren't doing too much work when they're walking.
Okay, so from start to finish, walk us through what actually happens when somebody comes in to see you for a foot exam.
Yep. So they come in if it's in person, then we do an X-ray right away, and that just gives us a baseline. A lot of times, people may not have just what we call acute pathology, something really wrong on X-ray, but it serves as a baseline so we know it can compare later on. Because generally, it's almost like the dentist. You get an X-ray every year, if you come in for your exam. And then we get them to the exam room. And what I'm looking at, I pretty much go through systems. And so, we have a vascular system, so the blood flow. So I'm checking their pulses, either, we say by palpation or by touch, or by Doppler, by ultrasound, so I can hear their pulse. We're making sure, we call it a capillary fill time. You pinch your fingertip, make sure, the blood comes back there. And then we generally move to like the nerves, so neurology. So we make sure they have good feeling at different nerve roots. And so we're touching different parts of the leg and foot to touch each separate nerve that comes from the back. And then we do like a musculoskeletal. And so we're making sure their joints are functioning well. They don't have pain in particular places. And the places that we pick to like, touch and make sure they're doing okay are places that most commonly people have pain at. Places where tendons insert, the Achilles tendon, various joints that we're just making sure that they're doing okay in those particular areas. And then we're just looking at the skin, right? So the main thing you look at is the skin, make sure they don't have any open sores, make sure they don't have any, their nails are looking okay, make sure they don't have fungal infections. And then I look at how they walk. And so a lot of times I'll do that, even before, if I can catch them just walking into the exam room is a good way. Because when you ask someone to walk, they kind of walk a little differently. But we all do. You try to walk right. But it's great to watch someone walk in the exam room or sometimes walk out. And you can really get that natural gait pattern. So those are the main things that I'm looking at when we're doing an exam on somebody.
Wow. And how long does that normally take?
Generally, probably takes about 15 or 20 minutes. And I should mention, I'm sorry, I forgot. I'll look at their shoes as well and examine their shoes to make sure they look okay.
And looking at the soles of their shoes and things like that. 15 minutes, that's it?
Yeah, 15 to 20 minutes, yeah.
Okay. And we don't take our clothes off. We're just taking our socks and shoes
Just taking the socks and shoes off. And a lot of people still, they're nervous about taking their socks and shoes off. I mean, feet are personal. You really don't, unless you're at the beach or something like that, you really don't take your shoes off a lot. And so, people who, don't want to show their feet, it's a personal thing, and we get that. So, you're always in a safe space, when you're in the office.
Absolutely. So what's the youngest that you can come in to get a foot exam?
So we see very young children because a lot of times their parents are worried about either them, walking late or how they're walking and things of that nature, like toe walkers. So a lot of times we'll see people who are like 2 years old that are coming in.
Really?
And see how they're doing. Or they can be even younger if they're like sitting and the posture of their.
What happened? Oh.
And parents a lot of times will come in and
Dr. Lanier, you're breaking up.
Can you hear me?
Now we can.
You can hear me now?
Yeah.
Okay.
So go back.
Okay.
You were talking about like 2-year-olds.
Yeah, like 2 year olds. Yeah. So I tell parents that, even if their kids are really young and they're not sure to bring them in, go ahead and bring them in. Unless something is very, very severe, a lot of times we can prescribe braces or shoes to help correct them. And sometimes if it's not super severe, it's still good to get a baseline because, if I'm pretty confident a kid will grow out of something, I'll say, let's just circle back around in like a year. If I'm not quite as confident, hey, let's circle back around in 6 months so I can take a look to make sure it's not getting any worse and to hopefully, that it's getting better. So yeah, we see pretty much all ages to, get foot exams.
Because the first thing that popped in my head was Forrest Gump. Like, what is he doing? Because at birth, was his feet like deformed or not?
Were they? I think they were, weren't they?
I think so.
The main thing that come to me was like when he has the braces and he's running and they all fall off and stuff.
Yeah.
That's the main scene that I remember. Yeah.
Okay, cool. Wow. Good information, Dr. Lanier. Through some of the notes. What is a GAIT? Is it GAIT analysis?
Yeah.
What's that?
Yeah, it's watching people walk. Watching people walk.
That's watching people walk. Okay.
Mm-hmm. Yeah, and that's
then.
Huh?
What's a proper walk? How should we be walking?
Well, I mean, just like everything, everybody kind of has their own thing, but there are some commonalities and baseline. We look at kind of the angle that people are walking. So people should be, like a little bit externally rotated when they walk, not too much, but like generally like 10 degrees or so from kind of the plane that they're walking in. We look at their knees to make sure they're straight when they're walking. Certain kids at certain ages will have different angulations of their knees. Also, boys and girls can be different like that. We look at their stride length, how long each step is as well. We look at if their heel contacts the ground and then it goes to the midfoot and the toe. We look at how long they stay in heel strike or forefoot strike. So there's a lot of things that go. There's whole classes on gait exam and how you do a gait exam. So it actually can get pretty complicated.
Right.
Yeah.
Wow. So where are we? Okay, well, we got through that fast. That's quick.
Yeah.
So,
27 minutes already, yeah.
Yes. Our favorite segment, of course, is Trap or Truth. And I just want to get right into it. If your feet don't hurt, you don't need a foot exam. Trap or truth?
That's trap. I think we talked about this before. Even if, your feet aren't hurting, at least especially like you say, if you're over 40, 50s, you should just get them checked out. Just make sure everything looks okay. Because again, the feet can be a window into your health.
Absolutely. Can pedicures replace a medical foot exam?
No, not replace it. You still want, someone who can take x-rays and, kind of get into the nitty-gritty of a foot exam. Still should get a pedicure if you're, medically okay to get one. It can still be something that's very valuable, but not necessarily replace a foot exam.
Trap or truth? Numbness is more dangerous than pain.
It can be. So I would say truth to that. If you have numbness, especially, of course, we got to talk about, our patients with diabetes, then it can certainly be something that is definitely more dangerous. I always see, when I'm in the hospital, a diabetic patient who didn't know they had a sore or a wound for a week or so, and then it progresses and they end up, having all this extensive surgery, amputations, and things of that nature. So numbness can be a silent, something that's really bad.
Okay, then we won. Good. Finish with the trap or truth. So what are some things that we could be doing at home? I mean, can we give our own self like a foot exam to kind of like, when you say pulses, what can we be feeling for ourselves?
I mean, you certainly can. I mean, when you should always be looking at your feet, right? Yeah. So, you should be noticing, just like anywhere else on your body, any abnormal lumps or bumps, any skin discoloration, any new like calluses that develop somewhere, any new moles or anything like that. So, gross inspection. So just looking at your feet, making sure there's nothing that pops up that wasn't there, a day ago, a month ago, a year ago. So just always being vigilant and just looking. I mean, you can palpate pulses if you want. I mean, just like your radial pulse, you can check your, dorsalis pedis and your posterior tibial and your popliteal. You can do that, but I think the easiest thing is just gross inspection, make sure things look okay, and not knowing when to call somebody.
Where on our feet do we feel pulses? That's the most obvious.
Yeah, so the most obvious, so the one on top of the foot is called the dorsalis pedis. It's kind of between like kind of where your second and third toes are, and then you go down to the middle part of your foot. Then you can feel it. And then there's another obvious one right behind kind of the ankle, the inside ankle bone, right behind that. So we call it the medial malleolus. It's just behind that, and you can feel it. It's the posterior tibial pulse.
Interesting.
Are you trying to feel yours now?
Yeah.
Can you feel it? Are you alive?
I am. Any last remarks that you have for us on what a foot exam is?
So it's something not to be scared of. It's something that you need, and you should, real podiatrist and see if that's something that you need to get. Especially if you're experiencing any type of, pain or numbness or anything that doesn't feel right. If you have a new bump on your skin or your foot, your ankle, call your local podiatrist and say, hey, can I get in for a foot exam? Like I say, it's nothing to be scared of, nothing that's going to hurt you. We're just here for you and want to make sure that you have good foot health, which translates into good overall health.
And one last question, just like our dentists and eye exams, does insurance cover our foot exams?
They do, yeah, because it's basically, billed as kind of a regular visit. And so it is generally covered by your insurance.
Okay, well, there you have it. So if you get your eyes checked, your teeth cleaned, and your oil changed, your feet deserve the same respect. And like Dr. Lanier said, what's the one sign that okay, yeah, I read that too quickly, but your feet deserve the same respect. So like you said, if you haven't had a foot exam, this is your sign to get one this year in 2026. And as a matter of fact, I'm going to take it upon myself to get a foot exam this year for the first time. So if you're watching this now or later, share, like, and subscribe to our channels on YouTube. You can find us on TikTok as well as LinkedIn as well. But get those foot exams because it could save your life. So that's all that I have tonight. Any last questions, or let them know where they can find you at, Dr. Lanier?
So yeah, Smart Set Foot and Ankle. We're on socials. Just Smart Set Foot and Ankle. Check us out. Again, like I say, like, comment, share.
Can you do virtual foot exams?
So you can, but I would say for a general foot exam, it will be better in person.
Okay, well, there you have it, ladies and gentlemen. I hope you all enjoyed your 3-day weekend for you finance banker employees. So it's time back to work tomorrow, but thank you again, and that's another 10 Toes Down episode.
All right, peace out.
Bye.